Joining me now is healthcare practitioner and convener Integration Summit Group Nigeria, Dr. Ekiyor. Dr. Ekiyor, good morning. It's good to have you, or afternoon. It's nice to have you join us right now. We are at a time where anyone who panics out of not knowing what to do on how to do, it will be seen almost as normal, but we don't have to panic. But talk to us generally from the window of health practitioners. Just how challenging is this situation right now?
All right, thank you and good afternoon. It's like a war situation. That's how I need to narrow it down. But again, as health workers, you're like a soldier who's gone to war. You see your colleagues being shot dead, but you keep moving on to defend your country. And that's where we have found ourselves in this situation. We have doctors willing to work, nurses willing to work, other health support systems willing to work. We're limited with our resources and knowledge of the disease. And it's not peculiar to Nigeria. The new thing is novel. So we learn every day from what is happening. Unfortunately, citizens and government in certain areas have not helped situations. Lagos is doing the right thing to protect workers. So we have minimal casualty in Lagos, if you look at it, compared to what's happened in Kano in the last few weeks. Negligence on the part of people, patients themselves, hoard information. Government is not putting the right things in place to ensure that doctors are protected, health workers, not doctors. Health workers are protected because the first line of action usually may not even be the doctor, maybe the desk nurse, maybe even the medical record officer. What we're saying is that we can't run away from this war. It's our war and we have to fight it. But government needs to support health workers in terms of ensuring that PPEs are available to do the work. And then citizens, for me, I think citizens have a major role to play. Each individual needs to protect himself to reduce this pandemic. You need to follow the guidelines that the NCDC has provided. You need to also watch out for everything that you do. I think businessmen, traders must also reduce what they have on their display shelf. You probably have samples only, and when people say this is what they want, you then provide from your stock. What has happened now, particularly in Kano, is a contamination of an entire system that we're only just seeing the tip of the iceberg. We're worried it may become the new epicenter before you know it in a couple of days, because those doctors are an indication that a whole lot of people have come in contact with this disease. I think that as health workers, we're challenged, but we are not going to step back. We're going to step up and continue to pursue this until we get the best out of it and break the cycle.
Now, the situation in Kano, where there were some mysterious deaths where no one really knew what was going on. We have the same case now, or similar case in Jigawa State, where it was recorded that about 140 people had come down or had died, as the case may be. What kind of urgent action should be taken in those states that are neighboring to that area? You talk about Katsina State, you talk about Zamfara State, or even Yobe State.
No, now this is the worry. The worry is that it's not about those states. Those states are just getting the heat. It's going to go through the whole country. You know why? There is continuous mass transit of these almajiris and northern traders trans-border on luxurious, on trailers conveying food and animal stocks into the southern states, which has been the normal trend. Unfortunately, with this pandemic, even though they say there's a shutdown, this traffic flow through the night is occurring. They're moving into Lagos, moving into Delta, into rivers and all of that. So the pattern of spread is that one almajiri, for instance, is contaminated, he joins his other colleagues, and they spread the virus between themselves, and then they move on and move on and move on. One trader is contaminated, and because it takes 14 days, you can actually transmit even when you're asymptomatic. So I don't need a magician to tell me, I don't need any scientific proof to tell me that the sudden death in those states is not connected with what is happening in the pandemic. They say a witch flies at night, in the morning the baby is dead. It's very classical. We're talking about coronavirus. We saw the videos that went viral in Kano where they say they don't believe in it. We heard about the very important personality who went to Kano and had meetings with Al-Majri. And then there's some death. I think that the government needs to be also open and transparent about this death. If there are COVID-19 deaths, we should know, and it should be documented by the NCDC. So Nigerians will know that this is a death thing that is there. If we continue to micromanage this information, people will think there are mysterious deaths here and there. This hasn't happened until COVID. So if COVID is around the corner and is in those states and people are dying in droves in a particular pattern where you know that they're all cliques of the same group, we don't need scientific proof to show that they are infected. I think the states should be shut down completely, locked down, locked in, no movement out of those states. Health workers should be moved in properly with the appropriate PPE. Isolation centers be well designated, and everybody needs to go through a screening. We've lost some emirs, some are still sick. High-profile Nigerians are dying. Citizens, the common citizens who are very important to us are dying, and health workers are infected. We may have lost some right now in those states. So we need to lock down those states completely. No exit from anywhere, no entrance from anywhere until we break the cycle.
Right.
If there's a need to declare a state of emergency, government needs to do that to help the governors to get it right.
All right. Dr. Chris Ekiyor, thank you so much for your time on the program.